There's also a long-term study that looked at regular marijuana users over a 25-year period and determined that, and this shocked me too, because I didn't realize this could happen. There's an actual decrease in IQ of 10 points, an average decrease in IQ. There are so many reasons not to legalize marijuana. And the director of the National Institute of Health had an editorial, I forget where it was published, I think the New York Times, a couple of weeks ago, that said, let's take a breath. You know, let's see what happens in Colorado. Let's look at what happens with lung cancer rates. Let's look what happens to our children, you know, before we go running off to legalize marijuana. I think it's a huge mistake. I'm going to shout it from the rooftops, and I'm going to do everything I can so that the experience in Portland isn't repeated. There are 2 benefits to Portland's legalization of marijuana. Number 1, my caseload for those cases is decreased dramatically. And 2, sales of Girl Scout cookies outside. I'm serious. It's been shown in California. Some enterprising Girl Scouts set up shop outside some hot houses, and their sales just skyrocketed. So,
and that's bad how?
All right, questions about the bill?
Governor, you mentioned that law enforcement doesn't have the resources to deal with the problem. Do you think that the jails and the courts do have the resources to deal with it? And if they don't, how does your legislation get at this problem?
Well, part of this process that we're going through is going to add DEA agents, judges, and DAs. So we are adding some resources to the problem. In addition to that, there's the Chief Justice is working on automating the whole system of video, what do they call it? Arraignments. So that we understand it's going to be a challenge. There's no question about it. We're just trying to return resources that we've taken away from the problem to fund other issues. But this now has become a crisis. We have to deal with this. And, you know, we just got to make it work.
Governor, why do you oppose expanding distribution of Narcan?
What's Narcan?
Narcan is the antidote to heroin overdoses. It can save someone from a heroin overdose. Naloxone is the other name.
No, I'm not against it. It's good in the hands of medical professionals. That's fine.
So do you believe that it should be distributed to parents, for example,
No.
who have a child? Why not?
Because it's an escape. It's an excuse to stay addicted. I think we need to let's deal with the treatment, the proper treatment, and not saying go overdose and, oh, by the way, if you do, I'll be there to save you. I think we need to deal with the bigger basic problem of drug addiction, drug trafficking, and drug abuse in the state. That's all I'm interested in.
But with all due respect, Governor, if it can save one life, why would you not support that?
I've said my piece on it.
Governor, one of the ideas that's before appropriations right now would further increase the limits on methadone treatments under Medicaid.
Increase the limits?
It would limit them. It would cut the limit down to, I think it substantially reduces to 2 years. Just your thoughts on that? Is that a good cost savings measure, or what?
Actually, it's the methadone clinics in the state of Maine are an absolute dismal failure. What I believe truly is, if you're going to distribute methadone, it needs to be in the clinical environment. And I will tell you, I have sat outside a methadone clinic, and if they try to tell me, I know of 2 locations, I'd like them to come out and tell me that there's a the clinical aspect to their treatment, because people spend less than 5 minutes in and out of that building. So it's inappropriate to say that there's a clinical aspect to it. If they have a clinical aspect, God bless them, because I think it's the right way to go. However, I think law enforcement will tell you that upwards of 90% of the methadone distributed from clinics is finding its way onto the streets.
So will funding of the bill be left up to the Appropriations Department, and is there any matching federal money that goes with these extra positions?
No, there's no federal money at this point. We will deal with that when the legislature addresses the issue.
Governor, I have a question with regards to the economy and legislative bills on federal law. When we're looking at the cost, as was stated here today, of $53,000 for a birth of a baby that is addicted to a drug. When we look at the federal programs such as a Medicaid expansion program that will help these states deal with these costs while you're fighting the drug addiction, would you not agree that the Medicaid expansion program might be a contribution, a positive factor that will help bridge that gap while you're fighting drug addiction to help those that are currently in need of help to find alternative programs to, say, the meth lab programs or that you feel are not productive and produce the results that you feel? And do you have an alternative?
First, are you a reporter?
I am
Or
here.
are you an advocate for MPA?
My name is Susan Alexa, and I'm an advocate for myself. I'm a student at the University of Maine with my major in political science.
He can
So what's your
address it,
question?
but I'm going to
You've
stop
gone,
you.
My
excuse me,
question.
wait a minute.
Thank you. Thank you
You've
very
been
much.
speaking for about a minute, and I haven't heard the question.
The question is, sir, when we're looking at the economic costs that your DA and other speakers today have spoken of that are related directly to these programs, babies and the cost that when a baby is born into drug addiction, that we want to increase, and I know you had 3 points I've written down too. We want to increase advocates, we want to increase judges. My question, bottom line, is you've got to find a way to treat what's currently in place, those that are addicted. And you said you didn't want to concentrate on welfare, but it is those public programs that are going to assist. So my question is, what's going to replace, or how are you going to pay for those programs that are going to help
There's a
those
state
that are
law,
currently addicted?
excuse me, let me try to, because there's a lot of people.
Sure, thank you.
There's a state law that prohibits any hospital or any physician to refuse to treat people. End of story. That is welfare. So is Medicaid. So I prefer that welfare over Medicaid. Because like you seem to think that Medicaid is free, I have evidence that it is not. Thank you.
Sir, I don't think that...
Next,
please,
please.
please be
Thank you,
respectful.
sir. Yeah, thank you.
Next.
Governor, back to the prevention as opposed to the enforcement. Do you believe that, it seems like you believe that more tougher law enforcement is the key to preventing people from wanting these drugs?
That's not what I'm feeling. That's not what I'm saying. What I'm saying is tougher law enforcement will help get the traffickers and the dealers off the streets. And I think you've heard from Roy McKinney that the dealers now are coming here. This is a full-blown business activity. And we've allowed it to go from a little bit of heroin to your buddy to a commercial enterprise. We need to break the commercial enterprise. When your meth labs, when you're predicting something like 40 meth labs and you've got rolling meth labs in vehicles, that's a real problem, folks. And it's not only a problem because it's meth, but it's a problem because it could explode and hurt people. So this goes far beyond the simple reason of treatment versus law enforcement. This is, we want to get the dealers and the traffickers, the people who bring the poison into the state, we want to get them off the streets.
Governor, in terms of deterrence, this has almost become a destination site, like you were saying. We've seen multiple arrests in Waterville and Augusta with people from New York coming here to deal drugs.
Sure.
How about stiffer penalties? Is that something you guys are thinking of?
You want to believe it. I'm thinking about it big time. I mean, there isn't a stiff enough penalty for me.
We'll take one more.
Governor, so if you get these people off the streets and they're in jail, many of the drug dealers are drug addicted themselves. Will any of this funding go for treatment programs within the jail so that when they're out, they've managed their drug addiction?
Well, that's not really true, number one. And number two, yes, we are working with the jails. They're, I don't know how they get in there, but they seem to find their way in at times. But there are programs, and we are currently working with a program to try to deal with prisoners who are addicted.
So you're disputing that drug dealers are themselves drug addicted when you said that's not true?
Yeah, some will never touch it.
And so, and you think that the programs within
I didn't say all of them are.
I hear you. I hear you. And so the existing programs are adequate to deal with if more drug addiction comes into the jails. The existing
Well, there's more
programs are
programs going in. I mean, if you saw what we just did at Maine the state police, state prison, we have a program in there, a program that's going to deal with people that have some issues that either over-medicate or under-medicate, and that we can deal with.
I'd like to offer up the other people who are up here. You heard the governor introduce most of them. They are all here in support of this bill. You all know Attorney General Janet Mills.
And they're
We have-
welcome to ask them questions too, please.
Yes. At this point, the formal presentation will conclude, but feel free to get the one-on-ones that you need.
Thank you.